If you take a living human cell right now, like today, suspend it in a nutrient-rich hydrogel, and push it through a microscopic 3D printer nozzle to build, I don't know, an artificial blood vessel.
Right, a basic capillary.
Exactly. There's a 90% chance that cell will be violently torn apart by fluid dynamics before the print even finishes.
Yeah, turned to shreds.
It's wild.
Yeah.
So you don't end up with a functional 3D printed organ. You end up with basically a perfectly shaped microscopic graveyard.
That is exactly what happens. I mean, the mechanical shear forces inside that extrusion nozzle are just, they're so intense.
Like, how intense are we talking?
They exceed the cellular membrane's structural limits by factors of 10 in some cases.
No.
Yeah. We often think of tissue engineering like building a static skyscraper, you know, like you're pouring concrete and just waiting for it to dry.
Right, just laying down bricks.
Exactly. But you are actually trying to assemble a skyscraper where every single brick is alive. It's metabolically active, and it is highly, highly sensitive to mechanical strain.
Because it's a living cell.
Right. And if the plumbing isn't integrated perfectly and instantly, by the way, the residents of that structure just suffocate.
Welcome to this deep dive. Today, we are taking you right to the absolute cutting edge of the 2026 landscape of 3D bioprinting.
And it is a fascinating landscape.
It really is. And we have a truly massive stack of sources to get through to make sense of this for you today.
We really do.
We are pulling from these exhaustive, multi-hundred-page market forecasts spanning the next decade from Mordor Intelligence and Straits Research.
Plus, we have a deeply technical IP and patent landscape analysis.
Right, the one from PatsNet.
Yes, the PatsNet report focusing specifically on vascular networks, which is crucial.
It is, and the scope of all this material really requires us to operate on multiple scales simultaneously.
Which is why we're also pulling in cutting-edge academic papers from Science Direct and Springer Nature.
The ones breaking down the brutal physics of it all.
Exactly. The rheology, the fluid dynamics of cell extrusion, it gets really dense.
But so important. Plus, we're integrating real-world commercial data, including a recent €10 million funding analysis of Cellbrix Therapeutics.
Which we'll get into, because that proves a huge point about the market.
Definitely. And we're pairing that with the ground-level business strategies of a biotech executive who is actively scaling these exact operations across the Asia-Pacific region.
So we have the science, the money, and the boots on the ground.
Right. Because the mission for our deep dive today is to completely cut through the sci-fi hype.
And there's so much hype.
So much. You see the headlines constantly, like printing replacement hearts for hospitals or the end of the organ wait list.
Which is a beautiful goal, but it skips over a lot of reality.
Exactly. We want to uncover the hidden physical parameters, the fundamental biological walls, and the very real commercial bottlenecks that are actually dictating the future of lab-grown tissue.
Because while it sounds like magic to just hit print and watch a machine build a living piece of human tissue, this field is bounded by brutally unforgiving laws of physics.
Okay, let's unpack this. To appreciate the micro-scale violence happening inside these printer nozzles, we first need to understand the macro-scale economics driving all this research.
The sheer scale of the capital flowing into this space is staggering.
It really is, especially when you compare the actual market reality right now in 2025 and 2026 against those sci-fi expectations of printing full organs.
Right. I mean, the growth trajectory is aggressive, depending on the specific inclusion metrics used by the analysts at Mordor Intelligence and Straits Research.
Which vary a little bit.
They do, but the consensus is that the global 3D bioprinting market sits right around $1.93 billion to $2 billion US currently.
So at $2 billion today.
Yes, but it's the acceleration that analysts are watching. Mordor projects the market will hit roughly $3.98 billion by 2031.
So doubling in like 5 years.
Exactly, representing a compound annual growth rate, or CAGR, of 15.59%.
That is massive for deep tech.
And Straits Research actually stretches the timeline slightly further and sees a clear path to an $8 billion valuation by 2034.
$8 billion. Wow. And when you look at where that capital is concentrated geographically, the North American market currently holds the dominant position.
Right, hovering around 38 to 39% of the global share.
Which makes sense when you look at the deep-pocketed federal programs fueling the foundational science.
Oh, totally. You have initiatives like ARPA-H's PRINT program.
Yeah, they just earmarked, what, $65 million?
$65 million specifically dedicated to constructing functional liver, kidney, and heart tissues.
That kind of institutional backing just creates this massive gravity, well, for academic hubs, right?
Absolutely. Places like Stanford and Penn State, it allows them to churn out the algorithmic and process breakthroughs.
But, and this is interesting, the North American share is massive, but the momentum vector actually points elsewhere.
Yes, the Asia-Pacific region is the fastest growing market globally.
Clocking in at around a 17 to 18% growth rate, which outpaces the global average.
Right, and this isn't the traditional narrative of Western hardware just being manufactured cheaply overseas.
No, it's not that at all.
This growth is being engineered by deliberate top-down policy shifts.
Like what's happening in India.
Exactly. India recently executed a major revision of their clinical trial guidelines.
Which is game changer.
Huge. They are actively allowing and encouraging non-animal testing methods for pharmaceutical and cosmetic safety validation.
Which completely changes the financial calculus for a pharmaceutical company.
Entirely.
Because if the regulatory body tells you that you no longer have to spend years breeding and testing on animal models,
Which is incredibly expensive and slow.
right, and you can instead validate your new compound on human tissue arrays, the demand for bioprinting hardware just skyrockets overnight.
Because the regulatory bottleneck was always the primary hurdle. By removing it, India essentially opened the floodgates for local bioprinting firms.
And Japan is executing a similar strategy, right? Although for different reasons.
Yeah, Japan is demographically driven. They have sovereign fund backing pouring into additive manufacturing specifically to address their rapidly aging population.
Because older populations need more replacement parts.
Exactly. Their healthcare infrastructure requires regenerative medicine solutions at a scale that traditional autologous grafting simply cannot meet.
That actually brings up a fascinating disconnect in the data.
What's that?
Well, when you hear regenerative medicine, the immediate image is a fully functioning, transplantable human heart.
Right, the sci-fi dream.
Yeah. But reading through these market reports, full organ replacement contributes almost nothing to that $2 billion current valuation.
Almost zero.
The entire industry right now feels like the computing industry in the 1960s. We aren't carrying sleek smartphones in our pockets yet.
We are building massive, room-sized mainframes for highly specific enterprise tasks.
Yes, that analogy holds perfectly. We aren't making consumer iPhones. We're making enterprise mainframes. So if the end goal is replacing the 20 million organs needed globally, aren't these just niche research tools right now?
They are, but the commercial engine driving this entire sector relies on what the industry terms stepping stones.
Okay, stepping stones. Explain that.
Well, you simply cannot fund a 20-year research arc to print a heart without generating revenue today. Investors won't allow it.
Makes sense. You need cash flow.
Right. So while academic institutes currently account for nearly half the demand, the fastest growing commercial adopters are contract research organizations, or CROs.
The pharmaceutical industry's outsourced testing labs.
Exactly. And they are advancing at a nearly 17% growth rate.
Yeah.
They are buying these machines to build organ-on-a-chip assays.
And when you look at the biology of why they are doing this, it really makes perfect sense.
It does. I mean, historically, we test cancer drugs on a flat, two-dimensional petri dish of cells.
But human tissue doesn't exist in 2 dimensions.
Right. It has depth, it has an extracellular matrix, it has complex cell-to-cell signaling that only happens in a 3D environment.
A flat layer of cells in a plastic dish is just going to react to chemical stimuli in ways that are entirely alien to how a solid tumor reacts inside a human body.
Completely alien. Printed 3D tissues bypass this fundamental inaccuracy.
And the ROI for pharma is huge, right?
Massive. They reduce their reliance on animal testing by up to 80%, which is an ethical victory, sure.
But money talks.
Exactly. More crucially for the pharmaceutical companies, they offer a greater than 90% viability rate for testing human-specific drug responses.
Because a mouse liver is not a human liver.
A murine liver simply does not metabolize complex biopharmaceuticals the same way human hepatocytes do.
Which leads to massive late-stage clinical trial failures. A drug cures cancer in a mouse, but fails in phase 3 human trials.
Happens all the time. Bioprinted miniature human liver models give these companies highly accurate human-specific toxicity and efficacy data years before they risk a human trial.
So the return on investment is immediate.
Yes. And we see the ultimate realization of this stepping stone strategy in precision oncology.
Oh, this is the post-tech stuff.
Right. The reports highlight work out of South Korea's Post-Tech, where researchers have successfully printed vascularized gastric cancer constructs.
But they aren't just printing generic tumors.
No, they are executing patient-specific models.
The mechanics of that are incredible to me.
Walk us through it.
Okay, so they take a physical biopsy from a specific patient's stomach cancer.
Right.
They isolate the specific malignant cells, culture them to expand the population, and then suspend those exact cells in a bioink that mimics the extracellular matrix of the human stomach.
Which is a highly specialized hydrogel.
Yeah, and then they print a 3D model of that specific patient's exact tumor, complete with a network of perfusible blood vessels.
It's mind-blowing. And once that tumor is printed and hooked up to a bioreactor, oncologists can pump a dozen different chemotherapy cocktails through the printed vascular network.
And they could observe, in real time, which specific combination induces apoptosis cell death in the tumor without damaging the surrounding healthy tissue.
They determine the optimal treatment regimen without ever subjecting the patient to the toxic side effects of a trial-and-error chemotherapy approach.
It is literally the pinnacle of personalized medicine.
It truly is.
But for you listening and wondering when this technology actually makes the leap from a testing tool inside a lab to an actual biological implant inside a human body?
The answer lies in soft tissue repair.
Right. Look at the data from Cellebrix Therapeutics. They recently announced a €10 million funding round.
And their lead therapeutic program isn't a solid organ like a heart or liver.
No, it is an adipose or fat tissue implant.
Adipose tissue might lack the glamour of a beating heart, but the unmet clinical need in reconstructive surgery is vast.
Yeah, patients suffering from severe soft tissue loss, whether from complex trauma wounds, full-thickness burns, blast injuries, or post-mastectomy breast reconstruction, they face a pretty grim set of surgical options right now.
Very grim. Currently, surgeons basically rely on synthetic silicone implants, which carry risks of capsular contracture and immune rejection.
Or they perform highly invasive autologous flap procedures.
Which are brutal.
Yeah, where they literally harvest a massive chunk of muscle and fat from the patient's own back or abdomen, sever the blood vessels, move it to the chest or the wound site, and microsurgically reconnect it.
You are inflicting a massive secondary trauma just to repair the primary one.
And flat necrosis is a huge risk, right?
A constant threat. That's where the transfer tissue dies because the newly connected blood vessels fail to adequately perfuse the tissue.
So what is Cellebrix doing differently?
Cellebrix is engineering a biofabricated, vascularized human tissue implant designed to biologically integrate with the host.
So the objective is to restore not just the aesthetic volume, but the actual living metabolic function of the tissue.
Exactly. If you can prove the underlying technology works for an adipose implant.
If you can implant a block of printed fat.
Right, and prove that the printed blood vessels actually connect to the patient's circulatory system and show that the tissue survives and remodels over time, you have validated the entire platform.
You have laid the biological foundation required to eventually tackle highly dense, metabolically demanding organs like the liver or the heart.
Which is the ultimate goal. But that jump from a printed tumor model to an implantable block of fat brings us to the absolute unyielding biological wall that dictates every single timeline in this industry.
It is the reason Cellebrix must start with adipose tissue. We have to examine the 200 micrometer barrier.
Yes. The 200 micrometer limit.
The PatSnap Technology Landscape Report dedicates its entire focus to this one highly specific bottleneck, the bioprinting of vascular networks.
Because without blood vessels, nothing else matters.
Right. To visualize why this is the most contested intellectual property frontier in tissue engineering, imagine you are a civil engineer tasked with designing a sprawling megacity.
Okay, I'm with you.
You construct hundreds of massive skyscrapers, you move millions of residents in, but you completely forget to install a single water main, sewer line, or highway system. What happens?
Total collapse.
Exactly. The outer edges of the city might survive by, foraging in the surrounding environment, but the dense populated inner core starves, suffocates, and collapses.
And a biological cell operates on those exact same logistical constraints.
It needs supplies.
Right. It requires a constant, uninterrupted supply of oxygen and glucose, and it needs a mechanism to clear metabolic byproducts like carbon dioxide and lactic acid.
In native human tissue, evolution solved this logistical nightmare through angiogenesis,
creating a dense capillary network that permeates nearly every cubic millimeter of our bodies.
But the physical limitation of that delivery system is absolute, isn't it?
It is. Oxygen and nutrients can only passively diffuse through solid tissue for a very short distance.
So if a cell is located further than roughly 200 micrometers away from a blood vessel,
which is roughly the width of 2 or 3 human hairs, for context.
Right, tiny. If it's further than that, that cell cannot receive enough oxygen. It rapidly undergoes hypoxia, followed by necrosis. It dies.
The necrotic core phenomenon, it is the absolute bane of early tissue engineering.
Because you can print a tiny paper-thin sheet of cardiac tissue, place it in a petri dish, and it will survive and even beat spontaneously, right?
Oh yeah, because the nutrient broth it sits in can diffuse entirely through that thin layer.
But the moment you attempt to print a clinically relevant volumetric chunk of tissue that is, say, 5 or 10 millimeters thick,
The cells trapped in the center are too far from the nutrient bath. They suffocate.
and worse, as they die, they rupture and release toxic enzymes that trigger an inflammatory cascade.
Killing the healthy cells on the outer edges. It's a chain reaction of death.
So you absolutely must print the plumbing.
You have to.
But printing a hollow tube that is perhaps 30 micrometers in diameter using a squishy, water-based biological hydrogel.
While ensuring it doesn't collapse under its own weight.
Right, and guaranteeing it doesn't leak when you pressurize it with fluid. That is a monumental physics challenge.
It's incredibly difficult. The PatSnap report actually categorizes the historical progression of this challenge into 3 distinct developmental phases.
Let's walk through those. Phase 1.
The foundational phase, spanning roughly 2011 to 2016. This represents the era where researchers realized direct printing of microvessels was just too complex for early hardware.
So they cheated.
Basically, yeah. The landmark breakthrough came from the University of Pennsylvania in 2012. Rather than trying to print the delicate hollow tube itself, they printed the negative space.
Sacrificial templating.
Exactly.
It's like the lost wax casting technique used by bronze sculptors, but applied to microscopic biology.
That's a great way to put it. They printed a complex 3D branching network out of a rigid carbohydrate glass.
Essentially a highly engineered hard sugar lattice.
Right. And once the rigid sugar network was printed, they poured their cell-laden hydrogel, the actual tissue matrix, all around it and allowed the gel to cross-link and harden.
So you're left with a solid hydrogel block containing an embedded matrix of hard sugar.
Yes. But the carbohydrate glass is highly soluble in water.
So by simply flushing the construct with an aqueous buffer solution, the sugar template dissolves and washes away entirely.
Leaving behind a perfect, continuous, hollow branching network of microchannels running directly through the solid tissue.
That is so clever. And then what?
They then took endothelial cells, the specialized cells that line the interior of every blood vessel in the human body, and fleshed them through those hollow channels in a liquid suspension.
And the cells just stuck.
Yep, they naturally adhered to the inner walls of the channels, proliferated, and formed a primitive, biological, perfusible vascular network.
Incredible. It was an elegant proof of concept. But that transitioned the industry into the development phase from roughly 2017 to 2021.
Right, because washing out sugar isn't really scalable for complex organs. So the focus shifted away from sacrificial templates toward direct extrusion.
This is where we get those crazy nozzles.
The coaxial nozzles.
Right, a nozzle suspended concentrically inside another nozzle.
Yes. This allowed engineers to simultaneously extrude a structural hydrogel from the outer ring while pumping a cross-linking solution or a liquid cell suspension through the inner core.
Instantly forming a hollow, continuous tube as the print head moved.
Exactly. And that technological leap brings us to the current era.
The translational phase, from 2022 to 2024, where the metrics of success have shifted from surviving in a petri dish to surviving in a living circulatory system.
This is where the PatSnap dataset highlights a really staggering benchmark from the Chinese Academy of Sciences.
What did they do?
They successfully 3D printed a multi-branched vascular tissue construct, but they didn't stop at in vitro validation.
They put it in an animal.
They took the construct and surgically implanted it into a living rat model.
The critical step being surgical anastomosis.
Right. The surgical team manually sutured the inlet of the 3D printed blood vessel directly to the rat's living carotid artery.
And the outlet to the jugular vein.
Yes. So the rat's own heart pumped pressurized, living whole blood through the printed synthetic vascular network.
And it survived the systolic pressure without rupturing?
It did, which is huge.
And there's another similarly critical benchmark coming out of South Korea, right?
From Yonsei University, they focused on small-diameter tissue-engineered vascular grafts, or TEVGs.
Because creating large blood vessels like the aorta is relatively straightforward.
Relatively, yes. But vessels under 6 millimeters in diameter are notoriously difficult.
Why is that?
Because the slow blood flow in smaller vessels makes them highly susceptible to thrombosis or blood clots.
So how did Yonsei do?
They achieved a 64.3% patency rate in canine models for these small diameter grafts.
And patency is the ultimate metric in vascular surgery.
It is. It means the vessel remained open, functional, and unobstructed over a long-term implantation period without collapsing or inducing a clot.
Achieving over 60% patency in a complex large animal model, that's an enormous leap toward human clinical trials.
It really is. Now, if we connect this to the bigger picture, the PatSnap report reveals a fascinating geographical arms race regarding this specific intellectual property.
Yeah, let's talk about the IP race, because China is aggressively dominating the patents related to upstream processes and the formulation of the biomaterials themselves.
Exactly. Out of a highly curated data set of over 80 crucial patents and foundational papers, at least 12 of the most technically advanced, paradigm-shifting records originate directly from Chinese institutions.
Conversely, the United States and European entities are heavily defending the intellectual property surrounding the hardware.
Right. The mechanical design of the bioprinters, the nozzle architecture, and the software control systems.
But regardless of who owns the hardware or the hydrogel, every geographic player faces the exact same biological bottleneck regarding the actual living material.
The cell sourcing bottleneck.
Because let's say you use a perfectly engineered American bioprinter to extrude a flawless Chinese patented bioink, and you design a mathematically perfect vascular network.
Where do the actual cells come from?
Right. If a patient is suffering from end-stage liver failure and needs a printed organ, you cannot harvest millions of healthy vascular cells from their failing body.
And if you use donor cells, you trigger a massive immune rejection response.
So the requirement for autologous patient-specific cells is absolute.
It is. And the emerging solution, heavily researched by institutions like Cedars-Sinai and Tel Aviv University, relies on iPSC-derived endothelial cells.
iPSC stands for Induced Pluripotent Stem Cells.
Yes, and the underlying mechanism of iPSCs is arguably one of the greatest biological discoveries of the century.
It's basically cellular time travel.
It really is. You take a fully differentiated, mature somatic cell, like a simple dermal fibroblast, a skin cell scraped from the patient's arm.
Just a normal skin cell.
Right. You introduce a specific cocktail of transcription factors, often referred to as the Yamanaka factors.
Named after the Nobel laureate.
Exactly. These proteins enter the nucleus of the skin cell and essentially hack its genetic programming, completely rewinding its epigenetic clock.
The adult skin cell sheds its specialized identity and reverts to a state of pluripotency.
It becomes a blank slate stem cell, possessing the potential to develop into almost any cell type in the human body.
But then you have to tell it what to be.
Right. The challenge then becomes directed differentiation. Researchers must expose that blank stem cell to a highly precise sequence of chemical growth factors, like vascular endothelial growth factor.
You coax it forward down a new developmental pathway.
Yes, forcing it to mature specifically into an endothelial cell.
So you take a patient's skin, rewind it into a stem cell, fast forward it into a blood vessel cell, mix it into your bioink, and print a vascular network.
And because the final printed tissue shares the patient's exact genome, the immune system recognizes it as self.
So there is no rejection.
No rejection and no need for a lifetime of immunosuppressant drugs.
It really is the holy grail of regenerative medicine.
But mastering the biochemistry of iPSCs brings us crashing directly back into the physics.
Because as we learned from those incredibly dense fluid dynamics papers we pulled from Science Direct and Springer Nature.
Having the perfect genetically matched endothelial cells and the perfect computer-aided design means absolutely nothing if the physical act of printing literally murders your cells.
Which brings us to the sheer paradox.
The sheer paradox. This is where the elegant biology of the cell crashes headfirst into the brutal reality of fluid dynamics.
Let's look really closely at the physics here. You have your premium bioink, heavily loaded with these precious, painstakingly derived iPSC endothelial cells. Your objective is to print microcapillaries that are perhaps 30 to 50 micrometers wide.
To overcome that 200 micrometer diffusion barrier we talked about.
Right. Naturally, to print a feature that small, you must extrude the ink through a correspondingly microscopic nozzle.
And the physical problem there is pressure. Biological inks, hydrogels, loaded with living cellular cargo, are inherently viscous.
They're thick.
Very. They possess a thick gel-like consistency required to hold a 3D shape.
And forcing a highly viscous fluid through a microscopic orifice requires an immense application of pressure from the printer's pneumatic or mechanical extrusion system.
And that pressure translates directly into massive shear stress within the fluid.
To visualize shear stress, imagine rubbing the palms of your hands together rapidly. That friction, that tearing force parallel to the surfaces, that is shear stress.
Good analogy. Now apply that to fluid moving through a tiny metal tube. The fluid exactly in the center of the nozzle flows the fastest.
But the fluid rubbing against the inner metal wall of the nozzle experiences friction, so it flows much slower.
Right. So a single living cell caught in that velocity gradient experiences catastrophic mechanical forces,
The top of the cell is caught in the fast-moving central stream.
while the bottom of the cell is dragged by the slow-moving boundary layer.
Oh man. So the cell is stretched, rotated, and subjected to a tearing force that just rips at its lipid bilayer membrane.
The mechanical models in the literature demonstrate that standard extrusion bioprinting can generate shear stress levels up to 10 to 15 times the known lethal stress limit for a eukaryotic cell.
That is insane. The shear rate can easily exceed 10 to the power of 3 inverse seconds.
And when researchers analyze the viability of the construct post-print, they frequently find that 70 to 90% of the cells have been mechanically lysed.
They are dead before the printhead even finishes the first layer.
It forces a terrifying realization. The bioprinter nozzle is an execution chamber.
So pushback here. The logical countermeasure. If the speed of the fluid is causing the shear stress, why not just print really, really slowly to reduce the pressure?
The engineer's immediate reaction is exactly that. Drastically reduce the flow rate and print incredibly slowly. But that brings us to the second half of the paradox.
Right.
Cell survival inside a micronozzle is governed by a mathematical relationship between two primary rheological factors: the absolute magnitude of the shear stress and the residence time.
Residence time being the total duration the cell spends trapped inside the high-stress environment of the nozzle.
Exactly. If you lower the flow rate to reduce the pressure and mitigate the peak shear stress, you proportionally increase the residence time.
So instead of the cell being violently torn apart in a fraction of a second, it is subjected to moderate, continuous mechanical deformation for a much longer period.
And the cumulative strain still causes the membrane to rupture.
It is a brutal balancing act. If you print fast, the acute stress spikes and rips them apart instantly. If you print slow, the prolonged strain tortures them to death over several seconds.
Extrusion bioprinting fundamentally forces the engineer to choose between three competing variables: print resolution, manufacturing throughput, and cell survival.
You can optimize for two, but the laws of physics dictate you cannot have all three.
Exactly. However, the Springer Nature paper provides a fascinating, highly nuanced look at the mechanics of cell death. Not all cells succumb to shear stress in the same manner.
Right, cell mechanics. The models reveal that a cell's probability of surviving the nozzle depends heavily on two inherent biophysical properties.
Its effective modulus, which is essentially a measurement of its structural stiffness.
And its beta value, which quantifies its fluidity.
My initial assumption, and the assumption of many early researchers, was that a stiffer, more structurally robust cell would inherently survive the mechanical trauma of the nozzle better than a soft, highly fluid cell.
Sounds logical, but the empirical data proves the exact opposite. Fluid-like cells survive the extrusion process at significantly higher rates than solid-like stiff cells.
To understand why, think about the material properties of a rigid rubber band versus a warm piece of taffy.
Okay.
A solid-like cell, characterized by a high effective modulus and a low beta value, fiercely resists deformation.
So when the shear stress hits it, its rigid cytoskeleton attempts to hold its shape.
Because it acts mechanically like a solid, it absorbs the energy elastically. But once the applied stress exceeds its yield point, it accumulates strain instantaneously and undergoes catastrophic rupture.
It snaps, like a dry rubber band.
Exactly. A fluid-like cell behaves entirely differently.
It deforms readily and easily, but it does so gradually over the entirety of its residence time inside the nozzle.
It stretches, elongates, and morphs into a teardrop shape along the fluid flow path.
But because its membrane is highly fluid, it stretches without tearing.
By the time it exits the nozzle, its morphology might be heavily distorted, but the cellular membrane is intact. It is bruised, but alive.
The most astonishing revelation in the literature, though, is that cells are not passive, inanimate spheres of liquid.
No, they possess complex mechanotransduction pathways.
They physically sense the shear stress through integrins and ion channels on their surface.
And they dynamically adapt to the violence in real time, within milliseconds.
The Springer Nature paper notes that if a naturally soft, highly sensitive cell detects the onset of massive shear stress, it will rapidly polymerize its actin network,
Instantly stiffening its internal cytoskeleton to brace for impact.
Conversely, a naturally rigid cell that senses an overwhelming mechanical strain will rapidly depolymerize its structure.
It actively fluidizes itself.
It undergoes a localized physical phase change, essentially going completely limp to survive the extrusion without snapping.
Biology is relentlessly resourceful, but these innate cellular survival mechanisms have hard mathematical limits.
Even if a cell completely fluidizes, survival depends on the critical capillary number.
Right. This is a dimensionless ratio comparing the viscous stress exerted by the flowing bioink against the elastic restoring stress of the cell membrane.
So if the viscous stress outpaces the cell's ability to stretch by a critical margin, the membrane bursts, regardless of its fluidity.
The biology simply cannot outscale the physics. We cannot negotiate with the mechanical realities of forcing matter through a microscopic hole.
Therefore, the industry has been forced to engineer incredibly clever, evasive workarounds in both the chemistry of the ink and the physical architecture of the pen.
Let's look at the chemistry first.
Okay, bioink rheology. Explain this.
The entire field relies on advanced rheology, the physics of how non-Newtonian materials flow and deform.
Right.
The researchers focus intensely on modulating the behavior of two specific categories of fluids, power law fluids and Herschel-Bulkley fluids.
Standard bioinks are generally modeled as power law fluids, specifically demonstrating shear thinning behavior.
Which is vital. Shear thinning is a remarkable property where the fluid's viscosity isn't constant.
When the bioink is resting in the syringe cartridge, it is thick, cohesive, and highly viscous.
But the moment the pneumatic piston applies pressure and forces it into the nozzle, the shear stress physically aligns the polymer chains in the hydrogel.
The internal friction plummets. The viscosity literally drops in direct proportion to the amount of force applied.
It is exactly how ketchup behaves.
Yes. It stays solid in the bottle until you strike the glass, applying shear force, which causes the internal structure to momentarily break down, allowing it to flow like a thin liquid,
before instantly regaining its thickness once it rests on the plate.
That shear thinning property is the biological saving grace of the extrusion process.
Because the bioink becomes dramatically less viscous at the specific locations of high pressure, primarily right at the metal walls of the nozzle, the fluid effectively lubricates itself.
The cells suspended in the center of the flow profile are shielded from experiencing the full lethal brunt of the friction.
The bioink becomes slippery precisely when the cells need it most.
And then there's the other category, Herschel-Bulkley models, which describes yield stress fluids.
Right. These are highly complex, multi-phase bioinks like jammed granular gels, lipid emulsions, or biological foams.
And they possess a distinct mathematical yield stress threshold.
If the applied pressure is below that specific threshold, the material acts entirely like a solid elastic block. It will not flow. It will simply compress.
But the moment the pressure crosses that critical yield threshold, the solid structure collapses, and it begins to flow, often transitioning into a shear thinning liquid.
It behaves exactly like toothpaste.
It holds a perfect, solid, cylindrical shape while resting on the bristles of your brush, but it flowed effortlessly as a liquid when you squeeze the tube.
Yield stress fluids are critical because of what happens after the extrusion.
The millisecond the bioink exits the nozzle, the shear stress drops to zero.
A yield stress fluid instantly regains its solid-like properties, locking the printed cells in 3D space.
Because without this property, a printed vascular tube would instantly slump and collapse into a puddle of goo before the next layer could be printed.
However, the mathematical models in the Springer paper reveal that cell viability is highly volatile in these fluids, especially at the shear boundary layer between the solid, unsheared plug flow in the center of the nozzle and the highly sheared, liquefied region near the walls.
Here's where it gets really interesting.
How so?
Because even with the most optimized shear thinning yield stress bioink, the microscopic nozzle remains a lethal gauntlet. You are still shoving living matter through a microscopic hole.
Right.
So the ultimate engineering workaround is to eliminate the nozzle entirely.
And the data reflects this pivot. The fastest growing hardware technology segment in the market, projected at an aggressive 15.94% CAGR, is DLP digital light processing.
Along with SLA, or stereolithography, and two-photon polymerization, these represent the frontier of light-based volumetric printing.
Light-based printing entirely bypasses the shear paradox because there is no extrusion, no pressure, and no nozzle.
In a DLP bioprinter, your delicate iPSC-derived cells are gently suspended in a large vat of liquid photosensitive biomic.
This hydrogel contains photoinitiators molecules that instantly react and cross-link the gel into a solid when exposed to a very specific wavelength of ultraviolet or visible light.
The printer utilizes a high-resolution digital projector placed beneath the transparent vat.
Instead of tracing a shape point by point, the projector flashes an entire 2D cross-sectional image of the tissue slice directly into the liquid.
Wherever the light photons intersect the bioink, the gel instantaneously cures and solidifies, gently locking the cells into their exact assigned coordinates.
The build platform raises a few micrometers, and the projector flashes the next layer.
The cells are literally just floating peacefully in a pool of liquid, and suddenly the liquid solidifies around them in the exact complex geometry of a capillary network.
There is zero mechanical squeezing, zero shear stress, and zero membrane tearing.
And the geometric resolution achieved by manipulating light is staggering.
The reports highlight 2-photon polymerization, or 2pp. By focusing 2 intersecting laser pulses to cure highly localized voxels of hydrogel, 2pp can fabricate perfusible vascular channels as small as 10 to 30 micrometers in diameter.
That is true capillary scale. No pneumatic extrusion nozzle on Earth can achieve a 10 micrometer resolution without turning the cellular payload into a liquid puree.
And because you are flashing entire planes of tissue simultaneously, the speed is exponential.
The Mortar report details a project where Stanford engineers utilized advanced AI algorithms to parametrically design a 500-branch vascular network up to 200 times faster than traditional CAD modeling.
They then executed that design using volumetric light methods.
Similarly, Penn State's HIDS bio process demonstrated the ability to cut tissue assembly time by 90%.
You are curing entire 3D biological structures in minutes, compared to the hours it takes an extrusion nozzle to painstakingly trace a shape line by line.
It sounds like the definitive solution, but light-based printing introduces an entirely different set of toxicological bottlenecks.
Unfortunately, yes. The photoinitiator chemicals required to make the bioink light sensitive generate reactive oxygen species during the curing process,
which can be highly toxic to the cells over prolonged periods.
Furthermore, if you are curing a single vat of homogeneous liquid, it is incredibly difficult to print multi-material structures.
Right. If you want to print a biomimetic blood vessel, you need smooth muscle cells on the outer layer and endothelial cells on the inner lumen.
A single vat of uniform photosensitive goo cannot easily achieve that spatial heterogeneity.
Which is why the industry hasn't abandoned extrusion printing. They just radically redesigned the physics of the nozzle.
Enter the baffled co-extrusion nozzle.
And the principle of chaotic advection. When you look at the geometry of these baffled nozzles, it's essentially the fluid dynamics equivalent of a baker folding puff pastry.
Chaotic advection is a principle where engineers intentionally induce complex, chaotic flow patterns to fold and mix fluids at a microscopic level without using microscopic pressure.
Instead of forcing the bioink through a single 30-micrometer hole, you use a massive macroscopic nozzle, perhaps several millimeters wide.
Because the orifice is huge, the extrusion pressure drops drastically, and the lethal shear stress plummets.
Well, wait, if you use a massive nozzle, you print massive, low-resolution tubes. How do you get microcapillaries?
Inside this wide nozzle, engineers install a precise mathematical array of static baffles and twisting channels.
You pump 2 distinct, thick streams of bioink into the top of the wide nozzle.
For example, one stream loaded with endothelial cells and one empty stream acting as structural support.
As the 2 streams flow downward and hit the first baffle, the fluid is cleanly split in half, rotated 90 degrees, and pushed back together. That's 2 layers.
As it hits the next baffle, the flow is split, rotated, and recombined again. 4 layers.
Do that 10 times, exactly like a baker repeatedly folding a block of butter and dough, and by the time the bioink exits the bottom of the wide nozzle, that simple dual stream has been geometrically folded into hundreds of microscopic alternating layers.
You have successfully created capillary-scale microfeature structures just tens of micrometers wide without ever forcing a single cell through a microhole.
The spatial resolution is achieved through internal geometric folding, while the shear stress remains incredibly low because the outer diameter of the nozzle remains wide.
It is a brilliant, highly elegant physical workaround to the sheer paradox.
The evolution of these nozzles points to a massive operational shift in how these biotech startups function.
In the early days, a researcher would formulate a new bioink, guess a pressure setting on the printer, hit print, and then check under a fluorescent microscope 24 hours later to see if any cells survived.
It was blind, agonizingly slow, and ruinously expensive trial and error, wasting thousands of dollars of iPSC cells per failed run.
The modern approach relies heavily on the DBTL core loop design, build, test, learn.
But the critical transition is that successful deep tech startups now entirely front-load that loop into digital space.
They utilize computational fluid dynamics, or CFD.
Instead of wasting physical cells, they use massive computing power to mathematically solve the Navier-Stokes equations for their specific non-Newtonian bioink flowing through a digital 3D model of their nozzle.
They map the exact shear stress profiles and predict the cellular viability computationally,
Identifying the precise zones of lethal pressure before they ever load a single living cell into a physical syringe.
They run the DBTL loop 1,000 times in software, optimizing the baffle geometry, saving immense capital and months of physical lab time.
This reliance on computationally heavy software, coupled with the need for highly advanced hardware, drastically alters the economics of running a bioprinting operation.
You aren't just buying a mechanical printer anymore. You are buying a massive integrated tech stack.
And that creates a formidable commercial hurdle when attempting to sell this technology into real-world laboratories.
Which brings us to the ground-level reality of commercialization and scaling.
Right. Because having the most mathematically perfect, low-shear, chaotic advection nozzle and a flawless vascular bioink means absolutely nothing if your company goes bankrupt trying to find buyers.
Exactly. To understand how these machines actually reach the market, we reviewed the strategic insights of Rupak Poddar.
He's a biotech executive responsible for scaling Selling's bioprinting operations across 8 vastly different countries in the Asia-Pacific region,
Including India, Southeast Asia, and Australia. Scaling deep tech capital equipment in diverse, highly price-sensitive emerging markets is a brutal commercial challenge.
A $500,000 bioprinter is not a SaaS software subscription you can just pitch over a Zoom call and download.
No, it is a physical, highly complex piece of capital equipment that requires sterile laboratory infrastructure, cold chain logistics for the bioinks, and highly trained PhD operators.
So how do you actually close a sale in that environment?
Potter emphasizes 2 foundational philosophies: consultative selling and scientific evangelism.
When a sales representative walks into a hospital laboratory in Bengaluru or a research institute in Singapore, they are not selling a list of machine features.
The lead researcher does not care about the stepper motor resolution or the touchscreen interface.
The researcher cares exclusively about securing their next round of grant funding, publishing in top-tier journals, and proving their specific biological hypothesis.
Therefore, the commercial strategy must pivot. You aren't selling a printer, you are selling research outcomes.
Potter details the necessity of deep discovery, spending hours, sometimes days, engaged with a scientific team to intimately understand the specific biological bottlenecks of their research roadmap before ever pitching a single product feature.
It requires scientific evangelism. In these emerging markets, you rarely find pre-existing demand for deep tech.
The researchers often don't know the technology exists, or they assume it is mere science fiction.
You have to actively create the demand by physically executing roadshows and hands-on workshops.
Pulling a delicate bioprinter across the country to physically demonstrate to skeptical scientists exactly how this novel technology integrates into and accelerates their highly specific workflow.
But a successful physical demonstration is only the first step. Skeptical scientists demand peer-reviewed validation.
They need proof that the machine generates data that prestigious journals will accept.
This reality forces companies to build an ecosystem rather than just a sales funnel. The strategy relies on identifying key opinion leaders, or KOLs, in a given region.
You partner deeply with these top-tier research institutes to establish centers of excellence.
You provide them with unprecedented technical support to ensure their early experiments succeed.
When a prospective buyer at a smaller university sees a highly respected KOL publishing groundbreaking, highly cited oncology papers using your specific bioprinter, the psychological and institutional barrier to entry drops massively.
Your early customers essentially become your most powerful marketing and reference sites.
And critically, the commercial relationship cannot terminate when the invoice is paid.
Potter highlights the always-on post-sales support mandate as the single most critical factor for long-term survival in the APAC region.
Silence kills pending deals, but abandoning a customer after the installation kills your brand reputation entirely.
Deep tech hardware breaks. Bioinks fail to cross-link. Cells die mysteriously.
Supporting those scientists through the inevitable technical trough of disillusionment, long after the purchase order clears, is what transforms a frustrated user into a vocal, loyal advocate for your ecosystem.
But let's look at the actual business models of the parent companies building these machines. They are operating in a precarious legal landscape that industry analysts refer to as the IP gray zone.
Right. From a strict legal and patent standpoint, human tissue, even if engineered in a lab, is generally considered a product of nature.
The implications of that are profound. You cannot broadly patent a bioprinted piece of human skin or a functional liver construct.
So if a startup burns $100 million of venture capital over a decade figuring out the exact biological sequence to print a perfect transplantable liver, a well-funded competitor can essentially reverse engineer the biological structure and print their own.
And the original startup has no legal recourse to protect the tissue itself.
Exactly the risk. Which is why the true intellectual property moat in this industry is never the final biological product.
The defensible moats are the proprietary geometries of the chaotic advection printheads.
The complex algorithmic manufacturing processes, the specific chemical formulations of the photoinitiators in the bioinks.
And critically, the BioCAD files the digital mathematical blueprints that dictate the routing of the vascular networks.
You patent the tools and the software, not the biology.
That legal reality leads to a highly pragmatic operational strategy highlighted in our sources, the toolmaker wedge.
If you are a new biotech startup, chasing the billion-dollar sci-fi dream of a fully functioning transplantable human heart is a fantastic way to generate press.
But it is an even better way to burn through 10 years of funding and go completely bankrupt in the regulatory purgatory of FDA clinical trials.
The successful startups pivot. They embrace the toolmaker wedge.
Instead of trying to be the company that prints the organ, they become the company that provides the picks and shovels to the rest of the industry.
The strategy often involves localizing the manufacturing of the hardware in cost-effective, high-skill regions like India.
By localizing production, they can slash the prohibitive import duties and shipping costs by up to 50%.
They drastically lower the price point of the hardware, and then they target MSMEs, micro, small, and medium enterprises.
They sell accessible, highly reliable, desktop-scale bioprinters specifically designed for the immediate revenue-generating applications we discussed earlier: drug toxicity screening and cosmetic testing.
They generate real, sustainable cash flow today, and they use that localized revenue engine to fund the massive, decade-long R&D required for true organ replacement tomorrow.
This raises an important question about the ultimate commercial endgame. As the market matures toward that $8 billion projection, what does the dominant business model look like?
Are these massive biotech conglomerates fighting a price war to sell the physical metal printer? Or are they fighting to control the recurring revenue of the consumable bioinks?
Is this simply the classic razor and blades model applied to biology, where you sell the complex printer at a loss just to lock the hospital into buying your highly lucrative hydrogels forever?
The data shows that the market leaders are moving far beyond a simple razor and blades dynamic. They are executing a strategy of total full-stack integration.
Look at the aggressive acquisition strategies of giants like Cellink, which operates under the massive BICO Group umbrella.
And traditional 3D printing titans like 3D Systems, who have pivoted heavily into bioprinting.
They're no longer just selling a machine that extrudes gel. They're selling an entirely closed, deeply integrated technological ecosystem.
They bundle their own proprietary AI-driven tissue design software. The software only exports files properly to their specific multi-material physical printers.
And the printers are optically and mechanically calibrated to only accept their proprietary, GMP-grade, medically certified bioink cartridges.
You mathematically design the tumor model on their software, you print it on their hardware, and you nourish it using their chemical inks.
And the integration goes even further up the value chain. They are now aggressively bundling cloud-based quality management systems, or QMS software, directly into the printers.
If a contract research organization is using a bioprinter to generate toxicity data for a formal FDA drug submission, the regulatory body demands an exhaustive, immutable audit trail of the validation and qualification data for every single printed construct.
By providing the entire integrated software, hardware, and compliance stack, these companies make their ecosystem virtually indispensable to the regulatory approval process.
They lock in massive recurring revenue through the constant consumption of bioinks, while simultaneously embedding their software deeply into the operational compliance of the laboratory.
It is the closed ecosystem model of Apple, applied with surgical precision to human tissue engineering.
We have covered an immense expanse of terrain in this deep dive.
We really have.
We started by grounding ourselves in the macroeconomics, looking at a $2 billion market that is currently fueled not by the sci-fi dream of instant organ transplants, but by highly lucrative stepping stones.
Pharmaceutical drug screening, precise oncology models, and soft tissue reconstructive repair.
We then zoomed in on the absolute biological wall, dictating all progress, the 200 micrometer diffusion limit.
We explored how the industry evolved from melting sacrificial sugar lattices to surgically anastomosing complex 3D-printed vascular networks into living mammalian models.
All while navigating the geopolitical IP race between the East and the West.
We tackled the brutal physics of the shear paradox, examining the mathematical reality of forcing a living cell through a microscopic nozzle.
And we marveled at the cellular mechanotransduction that allows fluid-like cells to dynamically adapt, essentially changing their phase of matter to survive the mechanical torture.
We detailed the engineering escape routes designed to cheat those physics, the highly calibrated rheology of shear thinning and yield stress bioinks,
The frictionless volumetric curing of light-based projection, and the chaotic advection of baffled nozzles that gracefully fold fluids like puff pastry to create microscopic resolution without microscopic pressure.
And finally, we brought it back to the boardroom, examining how executives actually scale this intimidating deep tech across diverse global markets.
Through consultative selling, scientific evangelism, the establishment of reference ecosystems, and the relentless pursuit of full-stack integration. But why should you, the listener, care about the mathematical equations governing fluid dynamics or the sales strategies of APAC biotech executives?
Because mastering these highly technical bottlenecks is the singular viable pathway to ending the global organ donor shortage, a devastating crisis with over 20 million people currently languishing on wait lists.
It is the technological key to finally eliminating animal testing and the foundation for delivering truly personalized medicine.
Where highly toxic treatments are tested on printed replicas of your own body before they ever touch your bloodstream.
The trajectory of this technology is clear, but as we look to the horizon, the research points toward an environment that completely upends everything we just discussed.
We spent this entire deep dive analyzing the struggle to keep soft, squishy biological hydrogels from collapsing into a puddle under their own weight before they can cure.
Gravity is a relentless, ubiquitous enemy of soft tissue engineering on Earth. It dictates the need for complex yield-stress fluids, dense structural supports, and high-pressure extrusion.
But what if we simply removed gravity from the equation?
Both the Mordor and Strace research reports highlight significant, rapidly accelerating investments from space and defense agencies.
Specifically, programs like NASA's Bionutrients Initiative aimed squarely at off-Earth healthcare.
The implications of bioprinting in the microgravity environment of the International Space Station or future orbital platforms are profound.
In microgravity, a highly fluid, uncross-linked bioink does not collapse under its own weight. The tissue structure is naturally buoyant.
The intense rheological restraints that force engineers to use high-shear nozzles or potentially toxic chemical photoinitiators on Earth are completely altered or bypassed entirely in low Earth orbit.
You can print with ultra-soft, highly biomimetic cellular suspensions that would instantly turn into a puddle in a terrestrial lab.
When we began this deep dive, we compared tissue engineering to building a skyscraper where every single brick is alive, and we marveled at how nearly impossible it is to build a structure without it collapsing under its own weight or the residents suffocating.
But what if the ultimate solution to the shear paradox and the 200 micrometer barrier isn't to build a better robotic crane or formulate a stronger chemical scaffolding here on the ground?
What if the first fully functioning, infinitely complex bioprinted human heart isn't manufactured in a sterile, multi-million-dollar lab in Silicon Valley or Shanghai,
but is instead assembled, layer by weightless layer, floating silently in orbital organ factories high above the Earth?
It forces you to look at the night sky and wonder if the cure to our most terrestrial biological limits will ultimately be found in the vacuum of space.